Anxiety disorder, meaning, symptoms, types, and treatment. Welcome to the Ultimate Wellbeing. Ultimate Wellbeing is a health and well-being channel. The Ultimate Wellbeing channel will help to improve your health and well-being. On this channel, you will see videos promoting good health and well-being that will assist you to improve your health and well-being to ensure your ultimate well-being. If you are new here, make sure to subscribe to our channel to get a regular dose of good health and well-being tips to become a better you for ultimate well-being. Relax, have fun as you see our videos and become a better you for your total well-being. Thank you. Anxiety disorder, meaning, symptoms, types and treatment are discussed in this video. Now, let us start. What is anxiety? The American Psychological Association, APA, defines anxiety as an emotion characterized by feelings of tension, worried thoughts and physical changes like increased blood pressure. Anxiety is a normal reaction to stress and can be beneficial in some situations. It can alert us to dangers and help us prepare and pay attention. Anxiety is a normal reaction to stress and can be beneficial in some situations. It can alert us to dangers and help us prepare and pay attention. What is anxiety disorder? Anxiety disorders differ from normal feelings of nervousness or anxiousness and involve excessive fear or anxiety. Anxiety disorders are a group of mental health problems. They include generalized anxiety disorders, social phobias, specific phobias, for example, agoraphobia and claustrophobia, and panic disorders. Depression is often related to anxiety disorders. Anxiety disorders are common mental health problems that affect many people. Approximately 25% of the population have an anxiety disorder that warrants treatment at some time in their life, and up to another 25% of less severe anxieties such as fears of spiders and snakes. Is all anxiety a disorder? Not all anxiety is a disorder. Everyone experiences anxiety and fear at times. These are normal and helpful human emotions that help us deal with danger. However, some people experience excessive and irrational anxiety and worries that become ongoing and distressing, and that interferes with their daily lives. This may indicate an anxiety disorder. Often there appears to be no obvious or logical reason for the way the person feels. This may make an anxiety disorder even more worrying to the sufferer. Symptoms of anxiety disorders. The main features of an anxiety disorder are fears or thoughts that are chronic, constant, and distressing and that interfere with daily living. Other symptoms of an anxiety disorder may include panic or anxiety attacks or a fear of these attacks. Physical anxiety reactions, for example trembling, sweating, faintness, rapid heartbeat, difficulties breathing or nausea, and avoidance behavior. A person may go to extreme lengths to avoid a situation that they think could bring on anxiety or panic. Panic attacks are a common symptom. A panic attack is a sudden feeling of intense terror that may occur in certain situations or for no apparent reason. A panic attack does not mean a person is necessarily suffering from an anxiety disorder. However, a panic attack is a common feature of each type of anxiety disorder. Symptoms of a panic attack may include shortness of breath, dizziness, rapid heartbeat, choking, and nausea. The cause of panic attacks is unknown, but they may be related to a chemical response in the brain, caused by actual threatening or stressful events or by thinking about stressful events. The brain response leads to physiological changes in the body, such as shallow breathing and rapid heartbeat. Panic attacks can be frightening. Some people say they feel like they are going to die or go crazy. People affected by panic attacks may avoid situations in which they think attacks might occur. In some cases, this may lead to the development of other anxiety disorders including agoraphobia. Types of anxiety disorders. Anxiety becomes a disorder when it is irrational, excessive and when it interferes with a person's ability to function in daily life. Anxiety disorders include generalized anxiety disorder, social phobias, fear of social situations, specific phobias, For example, a fear of open spaces, agoraphobia, or enclosed spaces, claustrophobia, and panic disorders, frequent and debilitating panic attacks. Generalized anxiety disorder. Generalized anxiety is excessive anxiety and constant worry about many things. The focus of the anxiety might be family or friends, health, work, money, or forgetting important appointments. People with a generalized anxiety disorder, GAD, display excessive anxiety or worry, most days for at least 6 months, about some things such as personal health, work, social interactions, and everyday routine life circumstances. Fear and anxiety can cause significant problems in areas of their life, such as social interactions, school, and work. Generalized anxiety disorder symptoms include feeling restless, wound up, or on edge, being easily fatigued, having difficulty concentrating, mind going blank, being irritable, having muscle tension, difficulty controlling feelings of worry, and having sleep problems, such as difficulty falling or staying asleep, restlessness, or unsatisfying sleep. Social phobias. People with social phobia are afraid of being negatively judged or evaluated by others. This leads to fear of doing something that may humiliate them in public, for example public speaking, using public toilets, eating and drinking in public, writing in public, or any social encounters such as parties or workplaces. Some social phobia sufferers may only fear one type of situation. Others may be concerned about several types of situations. This can lead them to avoid the feared situations, which can then lead to severe isolation and avoiding people and activities they usually enjoy. Specific phobias. A person with a specific phobia has a persistent and irrational fear of a particular object or situation. They may fear animals, places, or people. Fear of the object or situation is so severe that a person may experience physical symptoms and panic attacks. Fears may include dogs, blood, storms, spiders, or other objects or situations, but, in all cases, the anxiety is both excessive and interfering. The adult phobia sufferer usually knows that their fear is excessive or unreasonable. However, their need to avoid the object, place, or person can significantly restrict their life. Panic disorders. Panic or anxiety attacks are common. Panic disorders are less common, affecting about 2% of the population. For a person to be diagnosed with a panic disorder, they would usually have had at least 4 panic attacks each month over an extended period. Often panic attacks may not be related to a situation but come on spontaneously. During a panic attack, people may experience heart palpitations, a pounding heartbeat, or an accelerated heart rate, sweating, trembling or shaking, sensations of shortness of breath, smothering, or choking, feelings of impending doom, and feelings of being out of control. Panic disorder may be diagnosed if panic attacks are frequent and if there is a strong and persistent fear of another attack occurring. Anxiety disorders can have serious effects. An anxiety disorder may lead to social isolation and clinical depression and can impair a person's ability to work, study, and do routine activities. It may also hurt relationships with friends, family, and colleagues. It's common for depression and anxiety to happen at the same time. Depression can be a serious illness with a high risk of self-harm and suicide. Is recovery from anxiety disorder possible with treatment? Recovery from an anxiety disorder is possible with the right treatment and support. Effective treatments for anxiety disorders may include cognitive behavioral therapy aims to change patterns of thinking, beliefs and behaviors that may trigger anxiety. Exposure therapy involves gradually exposing a person to situations that trigger anxiety using a fear hierarchy. This is called systematic desensitization. Anxiety management and relaxation techniques, for example, deep muscle relaxation, meditation, breathing exercises and counseling. Medication, this may include antidepressants and benzodiazepines. Risk factors. Researchers are finding that both genetic and environmental factors contribute to the risk of developing an anxiety disorder. Although the risk factors for each type of anxiety disorder can vary, some general risk factors for all types of anxiety disorders include: temperamental traits of shyness or behavioral inhibition in childhood. Exposure to stressful and negative life or environmental events in early childhood or adulthood. A history of anxiety or other mental illnesses in biological relatives, and some physical health conditions, such as thyroid problems or heart arrhythmias, or caffeine or other substances/medications, can produce or aggravate anxiety symptoms. A physical health examination is helpful in the evaluation of a possible anxiety disorder. Where to get help? For the treatment of anxiety disorder, you can get help from your experts and relevant groups including your doctor, clinical psychologist, psychiatrist, and local community health center. Anxiety disorders, treatments and therapies. Anxiety disorders are generally treated with psychotherapy, medication, or both. There are many ways to treat anxiety and people should work with their doctor to choose the treatment that is best for them. Let us discuss the treatment of anxiety disorder through psychotherapy, medication, support groups and stress management techniques. Psychotherapy. Psychotherapy or talk therapy can help people with anxiety disorders. To be effective, psychotherapy must be directed at the person's specific anxieties and tailored to his or her needs. Cognitive behavioral therapy. Cognitive behavioral therapy, CBT, is an example of one type of psychotherapy that can help people with anxiety disorders. It teaches people different ways of thinking, behaving, and reacting to anxiety-producing and fearful objects and situations. CBT can also help people learn and practice social skills, which is vital for treating social anxiety disorder. Cognitive therapy and exposure therapy are two CBT methods that are often used, together or by themselves, to treat social anxiety disorder. Cognitive therapy focuses on identifying, challenging, and then neutralizing unhelpful or distorted thoughts underlying anxiety disorders. Exposure therapy focuses on confronting the fears underlying an anxiety disorder to help people engage in activities they have been avoiding. Exposure therapy is sometimes used along with relaxation exercises and/or imagery. CBT can be conducted individually or with a group of people who have similar difficulties. Often homework is assigned for participants to complete between sessions. Medication. Medication does not cure anxiety disorders but can help relieve symptoms. Medication for anxiety is prescribed by doctors, such as a psychiatrist or primary care provider. Some states also allow psychologists who have received specialized training to prescribe psychiatric medications. The most common classes of medications used to combat anxiety disorders are anti-anxiety drugs, such as benzodiazepines, antidepressants, and beta blockers. Anti-anxiety medications. Anti-anxiety medications can help reduce the symptoms of anxiety, panic attacks, or extreme fear and worry. The most common anti-anxiety medications are called benzodiazepines. Although benzodiazepines are sometimes used as first-line treatments for generalized anxiety disorder, they have both benefits and drawbacks. Some benefits of benzodiazepines are that they are effective in relieving anxiety and take effect more quickly than antidepressant medications often prescribed for anxiety. Some drawbacks of benzodiazepines are that people can build up a tolerance to them if they are taken over a long period of time, and they may need higher and higher doses to get the same effect. Some people may even become dependent on them. To avoid these problems, doctors usually prescribe benzodiazepines for short periods of time, a practice that is especially helpful for older adults, people who have substance abuse problems, and people who become dependent on medication easily. If people suddenly stop taking benzodiazepines, they may have withdrawal symptoms, or their anxiety may return. Therefore, benzodiazepines should be tapered off slowly. When you and your doctor have decided it is time to stop the medication, the doctor will help you slowly and safely decrease your dose. For long-term use, benzodiazepines are often considered a second-line treatment for anxiety, with antidepressants being considered a first-line treatment, as well as an as-needed treatment for any distressing flare-ups of symptoms. A different type of anti-anxiety medication is buspirone. Buspirone is a non-benzodiazepine medication specifically indicated for the treatment of chronic anxiety, although it does not help everyone. Antidepressants. Antidepressants are used to treat depression, but they can also be helpful for treating anxiety disorders. They may help improve the way your brain uses certain chemicals that control mood or stress. You may need to try several different antidepressant medicines before finding the one that improves your symptoms and has manageable side effects. A medication that has helped you or a close family member in the past will often be considered. Antidepressants can take time to work, so it is important to give the medication a chance before reaching a conclusion about its effectiveness. If you begin taking antidepressants, do not stop taking them without the help of a doctor. When you and your doctor have decided it is time to stop the medication, the doctor will help you slowly and safely decrease your dose. Stopping them abruptly can cause withdrawal symptoms. Antidepressants called selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs, are commonly used as first-line treatments for anxiety. Less commonly used, but effective, treatments for anxiety disorders are older classes of antidepressants, such as tricyclic antidepressants and monoamine oxidase inhibitors, MAOIs. Please note, in some cases, children, teenagers, and young adults under the 25th of May experience an increase in suicidal thoughts or behavior when taking antidepressant medications, especially in the first few weeks after starting or when the dose is changed. Because of this, patients of all ages taking antidepressants should be watched closely, especially during the first few weeks of treatment. Beta blockers. Although beta blockers are most often used to treat high blood pressure, they can also be used to help relieve the physical symptoms of anxiety, such as rapid heartbeat, shaking, trembling, and blushing. These medications, when taken for a short period of time, can help people keep physical symptoms under control. They can also be used as needed to reduce acute anxiety, including as a preventive intervention for some predictable forms of performance anxieties. Choosing the right medication. Some types of drugs may work better for specific types of anxiety disorders, so people should work closely with their doctor to identify which medication is best for them. Certain substances such as caffeine, some over-the-counter cold medicines, illicit drugs, and herbal supplements may aggravate the symptoms of anxiety disorders or interact with prescribed medication. Patients should talk with their doctor, so they can learn which substances are safe and which to avoid. Choosing the right medication, medication dose, and treatment plan should be done under an expert's care and based on a person's needs and medical situation. Your doctor may try several medicines before finding the right one. Support groups. Some people with anxiety disorders might benefit from joining a self-help or support group and sharing their problems and achievements with others. Internet chat rooms might also be useful, but any advice received over the internet should be used with caution, as internet acquaintances have usually never seen each other and what has helped one person is not necessarily what is best for another. You should always check with your doctor before following any treatment advice found on the internet. Talking with a trusted friend or member of the clergy can also provide support, but it is not necessarily a sufficient alternative to care from a doctor or other health professional. Stress management techniques. Stress management techniques and meditation can help people with anxiety disorders calm themselves and may enhance the effects of therapy. Research suggests that aerobic exercise can help some people manage their anxiety, however, exercise should not take the place of standard care and more research is needed. Conclusion. Anxiety disorder, meaning, symptoms, types and treatment have been discussed in this video. Anxiety is a normal reaction to stress and can be beneficial in some situations. It can alert us to dangers and help us prepare and pay attention. Anxiety disorders differ from normal feelings of nervousness or anxiousness and involve excessive fear or anxiety. Anxiety disorders can be successfully treated. Panic attacks are a common symptom of anxiety disorders. Treatment helps most people lead normal productive lives. However, untreated anxiety disorders can have serious effects on a person's life and relationships. Hope this video is useful and beneficial to you. We love to hear from you. Please post your comment below in the comments section. If you are new here, make sure to subscribe to our channel and press the notification button so you can get a regular dose of good health and well-being tips to become a better you for your ultimate well-being. If this video has been helpful and beneficial to you, then, give it a thumbs up, share it with your friends and leave a comment below. Kindly note that any information on this video is provided for educational purposes only. Diagnosis and treatment decisions should be made in consultation with your doctor. Thank you. Thank you for seeing the Ultimate Wellbeing videos.